whether they're young Democrats organizations or progressive orgs, in communicating with the mainstream media? What are some larger initiatives that we can take on, and how can we establish those relationships to help push our message into the mainstream and how it affects young people?
I appreciate that, and it's a timely question. What we're finding is one of the best ways to amplify the message, especially in the mainstream media, is to have a particular story or a particular individual or group of individuals that you can really highlight as the face for the need for reform. At the beginning of the call, we talked about the report that's been put out on the effect of insurance. One of the previous caller, or one of the previous callers, just talked about being denied pre-existing coverage because of pre-existing conditions. We're finding that it's very important to, and it's not hard to do, is to find the individual, find that personal story that allows you in different groups to basically tell the larger narratives, whether it's by letters to the editor, signed by a group of individuals that really focus on a specific story to help amplify the narrative, whether it's by use of blogs that you have access to. But again, it's we all know the means and are very familiar with them. But in order for this to break through, it's really the story. It's that individual. Occurrence that allows people to really hit home. Because what we find about this issue, and one of the reasons why health insurance reform comprehensively has never passed, is because it is the most personal and emotional issue that people can deal with. And the way to really bring home the need for reform is to highlight an individual, such as was on this call, who's had to go through bankruptcy at a young age, who's been denied coverage because of a pre-existing condition. And because of that, the existing system has all of these roadblocks put in front of them. Once the president signs this piece of legislation, discriminating for pre-existing conditions will be outlawed. And that is an important and effective story to tell. So I would just urge all of you to really, and again, it's not hard to do, is to really find your friends, your peers, your colleagues, your co-workers who have these stories and work with them to tell those stories, because that's what captures the imagination more than anything else on something as intensely personal and emotional as health insurance reform.
Thank you, David. Hope.
Thank you. Our next question comes from the line of Lisa Galloway. Please go ahead.
That's Isa with the I. I'm here in Houston, Texas with the Freedom and Justice Foundation. I have a quick question. We work through interfaith and also bipartisan promoting centrist policy. Is there a role that you see for the interfaith movement, and with the Bloomberg poll and the statistics that came out looking favorably for the public perception, what's the likelihood and any resources for people who want to promote a bipartisan effort on this?
During the joint session speech to Congress last week, the president emphasized certain components of his plan that really have that are Republican or traditionally considered Republican ideas. So there is a building block for you to begin with. The president talked about some ideas that were put forth by Senator McCain during the general election about a high-risk pool that would help people that don't have insurance until we can build the exchange. That's a Republican idea. It's a good idea. We should adopt it. The president talked about some medical malpractice reform, and yesterday we issued some guidelines that are going to allow states throughout the country to come up with their best ideas on how to do medical malpractice reform that meets certain principles that we put out. And that's an idea that some of our Republican friends have been pushing for years, and we believe we should explore it further. So you have got a good genesis to build from. And the president has consistently said that he is looking for good Republican and Democratic ideas. One of the things that came through in Bloomberg and some of the other polls is that when Americans are asked who is the president reaching across the aisle to Republicans, majorities of Americans say that he is. When the question is asked, are Republicans reaching across the aisle to work with the president? The numbers come back about maybe 20 or 30% say that they are. And so I think you will have an easy time, even in your messaging, to legitimately point to efforts of the president. To say, look, he is doing this in a bipartisan way. He is incorporating these ideas, and it's important for us to proceed down this way. In terms of the way to amplify the message, it's what we've been saying here: neighbor to neighbor, peer to peer, blogs, emails, letters to the editor, in the faith community, which has a stake in health insurance reform. I think that there's a good bipartisan story to tell.
Absolutely, and this is Paul again. I would just chime in that the president hosted a conference call with people of faith around the country, and we expected about 20,000 folks to dial in, and we had about 5 times that number. People that simply see this as a moral imperative, and folks from different denominations and different faiths that wherever they are on different issues, they come together around this one because it offends their conscience to know that millions of Americans are going without needed health insurance every day. So I would just put that out there for your consideration as well. Hope?
Our next question is from the line of Sarah Day. Please go ahead.
Hi, this is Sarah from Utah.